Thank you for joining us for this community briefing on COVID-19. Joining me once again today is interpreter Margie Prop. Thank you, Margie, for providing your services to our community. Tomorrow is Halloween, and we look forward to everyone safely having some good, scary fun. Remember, we can keep doing the things we love if we keep doing the things that keep us safe. That means simple modifications to our favorite activities, which enable us to prevent the spread of COVID-19. These start with those 3 W's. Wear a mask, wash your hands, and watch your distance, keeping 6 feet away from others whenever you are with people who are from outside your household. And here are some additional tips for having fun while staying safe. Keep gatherings outdoors and limit participation to 8 or fewer guests. Keep trick-or-treat groups to 8 or fewer people and avoid clustering at doorways and doorsteps. And I know this one's really hard, but wait until you get home to eat your Halloween candy. That way you can inspect it to make sure it's okay and you can wash your hands before you eat. These important practices are being reinforced by public health directors across Nebraska who now urge us to also avoid the 3 C's, and we've adapted those for Halloween as well, as you can see. And those 3 C's are avoiding crowded places, close contact, and confined spaces that don't have great ventilation. For more detailed information about how to stay healthy and safe on Halloween and every day, please visit our website at covid19.lincoln.ne.gov. That's where you'll find lots of information on how to access resources available to both residents and businesses during this pandemic. And you'll also find a dashboard with the latest COVID-19 data for our community, and we update that dashboard daily at about this time. Today, in Lincoln and Lancaster County, an additional 83 individuals have contracted COVID-19. The total number of lab-confirmed cases now stands at 9,413. Our total recoveries identified to date are up to 4,081. Since Sunday, we have experienced 3 additional deaths from COVID-19 in our community. On behalf of our city, I offer our deepest condolences to all those who are mourning the loss of their loved ones. And as is our practice each Friday, we are here to provide you with an update on the overall level of risk of transmission of COVID-19 in Lincoln and Lancaster County. This week, our risk dial remains at elevated orange for the 4th week. This indicates that the risk of COVID-19 transmission in our community is high. However, we need to be very clear with everyone about the fact that the dial is now on the verge of moving into red. Health Director Pat Lopez is here to explain more about our community's status.
Thank you, Mayor. As the Mayor said, we are on the verge of moving into the red. Our case numbers have been high for the last 7 weeks, but our data right now is fairly steady, unlike what we are seeing in Douglas, Sarpy, Hall, and Buffalo counties in Nebraska, and in areas across our nation. I want to share 2 graphs comparing Lincoln to other communities in Nebraska who have moved into red on their respective risk dials. This chart, the first chart, looks at the fatality rate. That is the percentage of confirmed cases that result in death. As you can see, Lancaster County is the lowest of the more populated counties in our state. To this point, we have been more successful in preventing outbreaks in long-term care facilities and protecting our more vulnerable populations. But we know that this can change quickly, and we must be strong and stay the course for the duration of this pandemic. The second chart is looking at the same counties and compares the number of COVID-19 cases per 100,000 population. Again, as you can see, Lancaster County is the lowest of these counties. We are sharing this today to give the public a look at where we stand locally. Without our directed health measures, which includes the mask mandate, we believe our number of cases and deaths would be much higher. Being on the edge of going into red on the risk dial is not a good place to be. And we need our whole community to remain united in this fight against the virus. We'll start a review of the indicators with the number of new cases. So far this week, 593 cases have been reported. Our weekly case counts have continued to be at a high level for 7 straight weeks. The week ending October 24th, we had 741 cases reported, a new weekly high. We have been dealing with the impact of the pandemic for 8 months now, but about 53% of our total cases have just occurred in September and October. The virus is widespread and has affected all age groups. The risk of contracting the virus is very high in our community. This is why we are in elevated orange on the risk dial and on the verge of moving into red. The lack of consistency of wearing masks and physical distance when around other people, even our family and friends, has affected our entire community. When we look at the 7-day rolling average, we see a fairly flat trend line over the past 2.5 weeks, from October 8th through October 26th. The numbers are high, but again, we are not seeing a rapid increase in new cases. Our cases are going up an average of 3% on a weekly basis, but we know this could change rapidly. The positivity rate is another important indicator, and here too we see the average weekly positivity rate has remained elevated for 9 weeks. Since the week ending August 29th, the average weekly rate has been 12.4%, with a low of 9.6% and a high of 14.6%. Again, this is a strong indicator that the virus is widespread in the community and the risk of spread is very high. Another factor is laboratory testing capacity and turnaround time. While testing remains widely available in the community, the effectiveness of testing is highly dependent on how quickly the laboratory results are provided to our department. Fortunately, the average turnaround time has greatly improved over the past 2 weeks. For the week ending October 24th, 73% of all results were received within 2 days. And so far this week, 88% of our results have been received in 2 days or less. Contact tracing capacity is also another primary factor. The sooner test results are received from the labs, the sooner public health nurses can begin the important step of contact tracing. This is a critical piece in preventing community spread and outbreaks. Our public health nurses work to make contact with those testing positive within 24 hours of receiving notification from the state. If you receive a call from one of our public health nurses because you have contracted COVID-19 or were exposed to someone who is a positive case, please do your part in keeping your family and community safe by answering the call and providing the necessary critical information to our nurses. The cooperation is really critical to slow the spread of the virus in our community. Isolation and quarantine are extremely important to slowing the spread of the virus. The two terms are used interchangeably, but they really are key differences in them. If you test positive, you are asked to isolate, to separate from others because the risk of spreading the virus to those around you is high, whether or not you have symptoms. I always think of saying isolation equates to illness, so just think of it that way and you'll remember what isolation is. If you've been exposed to someone with the virus, you are asked at the risk of contracting COVID-19 and potentially spreading it to others, so you are asked to quarantine. For more information about isolation and quarantine, visit covid19.lincoln.ne.gov or simply call the health department at 402-441-8006. Again, physical distancing, reducing your close contact with others, really is a precaution that all of us should be taking to help stop the spread of the virus. The fifth primary factor we consider in setting the dial position is the number of people hospitalized for COVID-19 locally. Our local hospitals are telling us that they are concerned about being able to maintain enough staff beds if our community situation continues to worsen. The average daily number of COVID-19 patients in Lincoln hospitals for the month of October is 60. That's the highest average of any month during the pandemic. Today, 76 COVID-19 patients are hospitalized, and 11 of them are on ventilators. 45 are Lancaster County residents, and 6 of them are on ventilators. 31 are from outside of our community, and 5 are on ventilators. A large number of hospitalized COVID patients are seriously ill and need care for many weeks. This month alone, 21 people in our community have died from COVID-19, and that is 46% of all COVID-19 deaths in Lancaster County during the pandemic. To determine the risk dial level, the Health Department continues to use local information and data from the past 3 weeks in 5 primary areas. This map shows how metrics associated with these primary factors are plotted on color-coded risk areas. As you can see, we are very close to red. We now have no metrics in green or yellow. In the orange area, we see connected cases, ICU availability, testing turnaround time, contact tracing, and average daily hospitalization. The remaining metrics of community spread are positivity rate, new cases, and case rate per 1,000 population are all in the red section of the map. You will find the location of the risk dial represented by the blue square outlined in red in the elevated orange section. The purpose of our directed health measure is to move these indicators in the other direction, towards less risk. We want to remind the public that our current directed health measure expires tomorrow, and the new one that will go into effect November 1st includes some changes. You can view the new directed health measure on our COVID-19 website. Gathering limitations have changed to be in line with our current state directed health measure. Any organization conducting youth sports must submit a sport activity plan, and the health department must approve the plan before practices or events can occur. The owners of venues in which youth sports occur must limit spectators to 25% of capacity. Spectators also must be in groups no larger than 8 people, and 6 foot of distance must be maintained between groups of spectators. Gyms, fitness and health centers, and martial arts studios are limited to 10 people or 50% of occupancy, whichever is greater. Religious gatherings, including weddings and funerals, continue to be governed by the current state directed health measure. The local directed health measure, including the mask mandate, now applies to public transportation. To date, StarTran has distributed 35,000 masks to its patrons to prevent the spread of the virus. Those masks were funded through the Federal CARES Act. Before I go, I again want to remind the public how important it is to get a flu vaccine. With the flu virus and the coronavirus both active in our community, getting a flu vaccine is more important than ever to protect yourself and your loved ones and to keep from overwhelming our health system. Vaccines are available through your doctor, your local pharmacy, or your employer. The Health Department is offering flu vaccinations for anyone in the community over age 6 months. An appointment is required. To schedule your flu shot, call 441-8065, and that's with the 402 area code. Appointments will be available between 8 and 3:30 p.m. weekdays at the Health Department Clinic at 31st and O Streets. You'll find more information about upcoming flu clinics on the Health Department's website at health.lincoln.ne.gov.
Thank you, Director Lopez. What we want you to take away from today's briefing is that the choices we all make have an impact, and that impact can be for better or for worse. Let's dig deep and do better. What does it take to do better? It takes being thoughtful, intentional, dedicated, caring, compassionate, and smart. The good news is that the people of Lincoln are all of these things. We can be greater than COVID if we continue to make the smart choices to stay safe. And speaking of people who are making smart decisions to keep our community safe, we can all be grateful to and proud of our Election Commissioner Dave Shively and his team at the election office. Thanks to them, voting this year is easier and safer than ever before. And judging by the long lines at the election office, they have done a superb job of ensuring that people in our community know the many ways that they can cast their ballot now through Election Day on Tuesday, November 3rd. Ballots can continue to be dropped off at the Election Commission office and at the secure drop boxes at all Lincoln City libraries. You can drop off your ballot at Lincoln City libraries through November 2nd. And if you're looking for a way to get to the polls, we want to remind residents that StarTran service remains free for the time being, and that's a great option. For more adventurous of you out there, our two scooter companies and our Bike Link service are offering free rides on Tuesdays to encourage voting. And if you're currently quarantined or isolated due to COVID-19, you still have options for voting. For more information on that or on any other election issue, you can contact the Lancaster County Election Commission. Their office is located at 601 North 46th Street, and their phone number is 402-441-7311. And of course, their website is at lancaster.ne.gov/election. If you voted early, you can track the status of your ballot on the Secretary of State's website, the Nebraska Secretary of State. That's at votercheck.necvr.ne.gov/voterview. And we encourage you all to do that to feel that reassurance, knowing that your voice has been heard and your ballot has been counted. And with that, we'd be happy to open up for questions.
This is Bill with 1011. I have a question for Director Lopez.
She'll be right here.
Hi, Bill.
Yeah, hi, Pat. I was hoping maybe you could elaborate on the difference between a COVID-19 patient and a regular patient. When people see, 76 COVID-19 patients, but hundreds of other beds in the hospital, why that is so much different and kind of the staffing that it takes to care for those patients.
It's what we talk about in the medical area, it's their level of acuity. So it means that many times the COVID patients require a much higher level of care, sometimes one-on-one care, for example, in the intensive care unit or even more. We have several of these patients may be in intensive care, but then others of the individuals are in the progressive care unit or step down from intensive care, and then still more in the general census population of the hospital. But they all require an extra level of care that's not necessarily seen, for example, in people recovering from a surgery or a fall or a break, because there's so many body systems involved and there's so much we really don't know about the virus, and we have really no known treatment other than the remdesivir and the steroid treatment. So there's all kinds of different treatments that are required that take a lot of resources, from respiratory therapy on down.
You had mentioned last week investigations involving possible outbreaks. Did you have any update on that?
No, we've had some bigger clusters that we've been working with at a couple of businesses that aren't open to the public, and those have been addressed. We don't have any other major ones right now, but we're continuing to watch for, we've been getting some information about some gatherings that have taken place. So right now we're in the process of investigating those, Bill, and of course we would release information that becomes available as it becomes available. We wouldn't wait until the press briefing.
Thank you.
Mm-hmm.
This is Matt Olberding with the Journal Star. I had a couple of questions for you. One is whether we've had flu cases. I think I heard about one this week. I was just wondering if there have been more. And then also, I'll just go ahead and give you the second one now. I'm just curious as to why, or what your thought is as to why we can't seem to get this under control, not even just in Lincoln, but everywhere. Whether it's just pandemic fatigue or people letting their guard down, or what that might be.
Let me answer the flu question first. We have only had one case of reported flu, and I believe I mentioned, we do monitoring continuously for flu in the community. We have what we call sentinel sites, so we're doing screening monitoring at schools, all of our hospital systems, with providers' office and that. So we keep a close pulse on that of what's happening, and we're not seeing any uptick. We've had the one case to date so far in our community. As far as what's happening, we see what's happening nationally, and we're being impacted here. And maybe sometimes it is the COVID fatigue, but I think it's also is that people kind of have let their guard down as we've opened up a little bit more. And what we've learned is that we really need to do those things of wearing our mask, washing our hands, and watching our distance. And I think the data we showed today is showing that our community is working on that. But we really have to be very focused and intentional right now. We are, in some ways, in instance, if one could say it, we haven't had as many cases per 100,000, but the cases we do have, our number is very great.
Any other questions from the media? All right, well, thank you so much for tuning in. Please keep making the smart choices to keep yourself, your loved ones, your neighbors, and our community safe. Have a great, happy, safe Halloween, and we'll see you next week.